Pictured here is a cochlear implant. A cochlear implant is an electronic medical device that replaces the function of a damaged inner ear. They are used by individuals who are profoundly deaf or severely hard of hearing. It is unlike a hearing aid in that hearing aids make sounds louder, while a cochlear implant takes over the role of the cochlea to provide sound signals to the brain. An interesting question to ponder is, how does the concept of cochlear implants negatively and positively affect the deaf and hearing communities as a whole? Cochlear implants are becoming increasingly popular, but are also a very controversial issue for the deaf community. Individuals in this community have a sense of passion and pride for being a part of it. When family members of deaf community members choose to get their deaf child a cochlear implant, there can be a lot of disagreement. People are very proud to be a part of the deaf community and expand it to other family members as well. It is frowned upon to take that privilege away from someone, especially a young child who has yet to experience the world for themselves. How young is too young? How old is too old? People of varying ages can receive a cochlear implant. During the first 3 years, a child's brain is quickly building language. If they receive a cochlear implant then, their hearing and speech can be what society considers normal. Children implanted before their second birthday have performed significantly better than those who receive it at a later stage. But how do you make this decision for your small child who cannot yet make this decision for themselves? Although some children of older ages can receive a cochlear implant and enjoy the benefits that come with it, they may have a more difficult time adjusting to the hearing world because they have already had years of language established as a member of the deaf community. In more recent years and with better research, more and more people are accepted to receive cochlear implants, some of which who would not have been allowed years ago, such as older adults. When amplification from a hearing aid may not be sufficient with severe hearing loss in these individuals, they may receive a cochlear implant instead, to provide alternate hearing rehabilitation by stimulating the auditory nerve and nervous system directly. For older adults who receive the implant, instead of using hearing aids, which is the norm of society, have shown significant improvement in speech perception scores after implantation. This results in more benefits for the individual overall. In this picture, 2 children are communicating through sign language, which is a critical aspect in connecting the deaf and hearing communities overall. How can we as a society honor both views on cochlear implantation? What positive and negative aspects do you see for both the deaf and hearing communities overall?